Hi, everyone. This is Richard Bowe. I'm one of the physicians here at Resurgens, and I'm going to be talking a little bit about total joint technologies and advancements that we've had over the last several years and what options we have for our patients who might be considering a joint replacement. So if you give me just a second, I will upload or show my screen. All right, so to get us started, again, I'm Richard Bowe. I am originally from Virginia, moved down here 5 years ago, had my training initially at Virginia Commonwealth University in Richmond, Virginia. That's where I did my undergrad and medical school. And then I did residency at Marshall University and my fellowship at University of Pennsylvania that specialized in total joint replacement. So a few things we're going to cover today. Kind of a variety of topics around joint replacement. First thing is going to be robotic-assisted surgery, quad-sparing total knee replacement, same-day surgery, and then lastly, anterior hip replacements. So getting started, the pictures you see are kind of progression of knee arthritis and then what we would do if it gets to a point where we need to consider surgery. So initial picture there shows a non-arthritic knee. You can see the space between the bones there. No arthritis is present, and this is a more advanced one. The second picture, you can see it's bone on bone. There's no space, and so that's where we start talking about, do we need a knee replacement or what other options can we do? And of course, there's an in-between where we would do other treatments if you're symptomatic. The second two images on the right show a total knee replacement, one in the front view and then one on the side view. And you can see it's basically just a kind of end caps, as I like to put it, on either bone with a plastic piece in the middle that recreates that joint space. So non-operative treatments, these are things that are going to be around for anybody that wants to avoid surgery in the meantime or is not having enough symptoms to warrant surgery. And we try and use these as much as we can until it gets to the point where they're either not working or the pain is too severe. So for injections, there's steroid injections, which are also known as cortisone. There's gel injections, which are basically artificial joint fluid, kind of lubricates the joint. And then there's platelet-rich plasma. And platelet-rich plasmas become more popular in recent decades. It's basically where we spin blood down, get the platelets in the plasma, which has some natural healing and anti-inflammatory properties, and inject that into the joint or site of injury. And these have shown pretty good results, about similar to cortisone injection. However, they can last longer. And for these injections, the steroid injections last about 3 months on average. Sometimes they last longer if we're lucky. The gel injections, they're kind of 50-50. Not everybody gets full relief. If the patients that do get relief, typically they last about 6 months. And then the platelet-rich plasma, the PRP, that can last anywhere from 6 months to a year if it works. Medications that we can do would be Tylenol, which is acetaminophen, anti-inflammatories or NSAIDs, like ibuprofen, Aleve, or prescription versions of those. And then there's topicals like Voltaren or diclofenac gel or even lidocaine patches. Bracing is another helpful thing with knees. The hinge knee brace, which is a little simpler than the brace you can see here, basically just supports the sides of the knee, gives it a little more stability. The unloader brace that this picture shows almost takes the weight off of the affected part of the knee. So if someone has knee arthritis on the medial part or the inside part of the knee, this brace can be used to kind of put more weight onto that outside part of the knee to make it a little more bearable. Therapy options include physical therapy, dry needling, ultrasound. Physical therapy is great in building strength and reducing inflammation. And then dry needling and ultrasound are more popular these days. And I think they do have really good uses, mainly for reducing inflammation and stubborn or chronic pain. So onward to total knee replacements. Now, total knee replacements these days, a lot of people are doing new techniques and new methods. Robotics is one of these things, and robotics is not the type of robot that you think of, with Rosie from the Jetsons or Da Vinci. This is what you would use for general surgery, like abdominal surgery. This is more of a more compact. It's almost like navigation and assistance in making things much more accurate and detailed. So this allows for several different benefits that I'll address, but you can see this is not the type of robot that most people picture when they think about robotic total joints. So some of these benefits includes smaller incisions. The reason for that is we don't need the traditional instruments that we used to use for knee replacements. It's more accurate. So the robot can see, parts of a millimeter. Humans, we can see 1 millimeter, 2 millimeters difference, or a degree or two of difference. These robots can really tell a much more small change. And so that makes it more accurate. And because it's more accurate, it's less soft tissue damaging. Again, that's also kind of goes in line with the smaller incisions because we're not having to use these big instruments to do the knee replacement anymore. The less soft tissue damage and the smaller incisions leads to quicker recovery. So because this knee is more balanced, because it was more accurate, it typically gives patients a quicker recovery in terms of getting their motion back and getting back to the things that they like to do. There's also less pain, and that kind of goes in line with all these things. It's a less traumatic, less smaller incision, and then obviously will lead to less pain. So this is a picture of robotic. This is initial navigation where we are kind of mapping out the knee, and you can see there's a little robotic raise so that you do need 2 little poke hole incisions above and below the knee. And that is used to help the robot know exactly where they are. So this is a traditional knee replacement scar. You can see it's quite long. And this is one of my patients who's just about 2 months out from surgery. And you can see it's a small incision, heals great, and gets them back to their activities that they like to do. So these are some screenshots of what we're doing with a knee replacement using robotics. So initially we're mapping out the femur and the tibia or the knee joint. We can do this without CT, so you don't need unnecessary radiation. Then you can adjust where you want the implants to go. And we can use a tensioner, which I'll show here, which we can balance the ligaments and really see how everything is going. With that, once we have all this data, we can then fine tune where we want this implant, adjusting a lot of these parameters so we get the knee exactly where we want it with good balance. Then we take this robotic burr. This is where it takes less soft tissue damage. Normally we have to make big incisions and make a big hole in the femur, and it's not minimally invasive. So this is something that's more minimally invasive because we're only taking the bone that we need to take. We're not taking any extra. And with this robotic burr, again, this is going down to like 0.5 millimeter in terms of the amount of bone it takes. So it's very accurate. Once we do all this and get the implants on, we trial it. And so with that trial, we take it through range of motion. There's also a graph that shows it balanced. And once we're happy with that, then we can put the final implant in. So this is what a post-op knee replacement looks like. As you saw in the initial slide, that's kind of what that knee replacement looks like. That's a ceramicized metal. It's not showing the okay. And then let me see, make sure we're seeing everything. Okay. So what we'll do is I think that some people weren't able to see the PowerPoint. So I'll just do it through this, not typically how we do it, but that'll work. Okay. So this is a knee replacement right there. Ceramicized metal, which is a titanium alloy. And then this is a partial knee replacement. So the partial knee replacement is basically a third of the knee replacement. So for some patients, they only get arthritis in one part of the knee. And if the case, then we can do a smaller surgery, which is a partial knee replacement. And that just goes into the part of the knee if the rest of the knee looks okay. All right. So the next thing would be quad-sparing total knee. So this is another technique that we're using these days to reduce soft tissue damage, making recovery easier. This technique is also known as subvastus approach. So the traditional method is where we have this large incision that we have to cut through the tendon of the quadriceps and around the kneecap to be able to get into the knee. There's been some changes to that where you don't go all the way through it, but the one I'm talking about here is the quad sparing, and that is where we do not cut any muscle or tendon through this approach. And so what we're basically doing is just moving this part of the quad and the tendon around, moving it to the side to be able to access the knee. So benefits of quad sparing plus robotic knee replacement is that you really get synergistic benefits. Both of these result in less pain. Both of these result in quicker recovery and more early motion. They also allow a smaller incision. So this, see if this plays. But this is a patient of mine who was 2 weeks out from knee replacement, walking without a walker or a cane. And he was doing great. He had very little pain at all. So that's, pretty typical of a lot of patients. Everyone recovers differently, but we really have seen a much quicker recovery for patients that were using the robotics and the quad sparing technique. So expectations after knee replacement. This is, of course, one of the most common questions that you might see. For 6 to 8 weeks, I expect about 80% recovery. And again, everyone's different. Everyone gets results at a different speed. But by that 2-month mark, you should be able to do most of your day-to-day activities and even some light sports if you're feeling like it. You're still going to have some aches and pains. Nighttime pain can kind of linger for several months. Morning stiffness, when you first get up, that knee feels pretty stiff. All those little things can take several months to get better. But about 80% of that recovery is in the first 2 months. No functional restrictions for my patients after 6 weeks. So if you want to go to the gym or play pickleball or tennis, you can start dabbling into that. Typically, high impact activities have traditionally been frowned upon. However, there's really not any data to support that it would wear out your knee replacement or your hip replacement any faster. So if anyone's passionate about running or basketball where they're jumping a lot, that's something that I'm okay with you doing as long as, it's clear that there's a possibility of things wearing out. But most of the time we're doing knee replacements not to make people sit around and not do what they want. We want them back and enjoying their activities. Most patients get off their walker within 2 to 3 weeks. Some people faster, some people a little bit slower. And then physical therapy is important, especially the first 6 weeks. My rule of thumb, the more motion you get those first 2 weeks after surgery, the easier the rest of your recovery gets. So more motion is always better. Next topic would be same-day surgery. So same-day surgery has been a big change in the orthopedics world and probably some other surgical specialties in the last several years. People have traditionally had knee replacements and hip replacements in the hospital, and they're staying there for a few days, even up to a week. While that can still be needed in some patients, a vast majority of patients can be treated in a surgery center and go home the same day. So some of the things we look for to determine if someone's a candidate for a same-day surgery would be their health status. Are they healthy enough, and do they have any health problems that would prohibit them from being treated at a surgery center? Do they have adequate home support? Do they have a family or friend that can stay with them for at least 24 hours after surgery and make sure that everything stays safe? Their home safety. Do they have a 3-story walk-up townhouse to get into the front door, or is it a lot of animals that may create a tripping hazard? Some patients can go home even with 3 stories of stairs to get into their house, but for most people that may be a barrier to getting them back into the house that same day. Are they motivated? An important part of knee replacement is being motivated. You want to get better. You want to have a good knee and a good hip replacement, and being motivated is a key to that, especially for same-day surgery. And then mobility. If someone has very difficult time mobilizing at baseline, even though it's arthritis, but if only short distances are able to be traversed, maybe using a rollator or something, maybe same-day surgery is not ideal for them, and that may be someone who's better suited for the hospital just to have a little fallback in case they need to stay overnight. So what happens with the same-day surgery? So same-day surgery, typically you get there about an hour or two before surgery. Pre-op takes care of everything, gets you any kind of medications you need, goes over the process. Then this anesthesiologist will typically do a nerve block. And so that's just a couple short injections to numb the nerve, and that lasts about 12 to 24 hours. And then during surgery, what we'll do is I'll also inject this drug called Zinrelief. And that is a combination of bupivacaine and meloxicam, so an anti-inflammatory and a numbing medicine that slowly releases over about 3 days. And so that gives you a nice kind of baseline pain control during those first 3 days where pain is its worst. Surgery takes about 1 to 1.5 hours. And again, that is done in the surgery center and with the robot if needed. And then we get you back to recovery. In recovery, you're there about 1 to 2 hours. Therapy will come see you. You'll be doing stairs before you leave home. You'll walk several steps around the surgery center to make sure that you're adequately safe to go home. So benefits of the same-day surgery. It really does show a quicker recovery for patients. And so most of these patients, again, are motivated or they're healthy, and we're doing it at the surgery center, we're able to get you back to your home where you feel comfortable, where you can start therapy faster. And so that overall leads to a quicker recovery. there's a lower risk of complications. So no one really likes to be in a hospital. I don't like to be in a hospital either. And, one of these reasons is, there's a lot of complications that can happen in hospitals, whether it's infections or falls or, other injuries that can happen. That's rare, but there is a significant decrease in risk with infection when you have surgery at a surgery center. So that's one of the biggest drivers that's been taking hip or knee replacements out of the hospitals and into the surgery centers. Then there's earlier rehab. You're there doing therapy an hour after surgery. Typically, it takes an hour or two beyond that at the hospital. So we get you up and moving a little faster, and then you can go home and start your therapy the next day without any delays. It has a higher patient satisfaction, and this has been shown across the country. Patients are happier when they have their surgery done at a surgery center. Not to say a hospital-based surgery is bad or people aren't happy with it, but it's just one of the trends that we've seen across the nation. And then specialized staff. These surgery centers are typically either orthopedics or GI, or they have their own specialties. So at our surgery centers, our staff are only doing orthopedics, and so that is all they do all day long. And so when someone does something repetitively, they tend to get good at it. And so we've handpicked our team at our surgery centers to really be the best and get you the best result. And so that has made a huge difference. So hip arthritis. Hips are a little different. So hips are more of a simple joint. It's more just a ball and socket joint. As you can see, there's a ball right there. You got the socket, and there's space in between. Arthritis can appear in several ways. So it can be bone on bone up here. You can get bone on bone at the lower part of the socket. So this is more of a traditional way that we see it, where it's just bone on bone at the top of the socket there. And then you can see the subsequent picture there is a hip replacement. That is a similar material to the titanium alloy knee replacements. Again, it's titanium alloy, plastic, and a ceramicized metal or ceramic. So non-operative treatments for a hip that has hip arthritis. Typically, it's slightly less options than a knee arthritis, because bracing is not as effective. There's not as many shot options for hip arthritis. The steroid injections are the standard go-to, but even those are not as reliable as a knee injection. So hip injections with steroids, I typically tell patients, we hope for 2 to 4 weeks. It may be 3 months, it may be 2 weeks, but it's variable. We don't really know until we do it and see how long it lasts. There's also PRP, which we talked about for the knee. It's been a little less studied, but it has shown some promising results with hip arthritis. Again, nothing can regrow cartilage. So PRP, platelets, platelet-rich plasma, or even stem cell injections, which I do not do, but some places around Atlanta do. Even these stem cells do not replace or regrow cartilage. So that's kind of a misconception that's out there with a lot of marketing and advertising. And so I have to, oftentimes reiterate that with patients. We don't want to be offering any false promises. And so, making sure that we know what we're getting and what it's going to do is important. And then medications, same thing with the knees. Tylenol, anti-inflammatories, topicals, that's kind of the go-to for that. Therapy can be very helpful with this. It builds up strength around the hip. It improves motion. While it may not delay surgery too much, it is certainly helpful. And it's one thing I didn't mention for both hips and knees. I have everyone do some therapy before surgery, as that can really build up strength, kind of get your body ready for hip or knee replacement. And then bracing, again, not as effective as knees. It's really hard to brace the hip. So a total hip replacement, a couple different ways that we can get into the hip. Traditionally, it's been the posterior incision, which you can see here on this picture here. It kind of goes along the side and then posterior part of the buttock. And then there's the anterior approach, which is more in the front of the hip. So the anterior approach has become more popular in recent years, but the standard is still the posterior approach. And so the posterior approach, you do have to cut tendons in the back of the hip and separate some muscles from the bone to be able to get into the hip. And so one of the issues with that is that can lead to a risk of dislocation where the hip pops out of socket. So there's some restrictions that doctors will place on you if you had a posterior hip replacement. And one of those is not bending beyond 90 degrees, no sitting in low chairs, no crossing your legs or turning your toes inward. Now, one of the reasons that the anterior approach has become more popular is because you don't have to worry about all these restrictions. So The anterior approach there we're not cutting any muscles or tendons, we're just going between them. And so with that, we don't have to give you restrictions about sitting in low chairs, crossing your legs, or turning your foot inwards. And so that's been a huge change with hip replacement. Some of the benefits of anterior approach: less pain and less soft tissue damage. As you can imagine, we're not cutting muscles and tendons. It's a smaller incision. You're going to have less pain. And because of that, recovery is typically a lot faster. There's no restrictions. People do yoga. I mean, there are some crazy yoga moves that I will tell people who are into yoga to maybe avoid, but vast percentage, 95% of my patients, I give them no restrictions. And so that has been a game changer. And then faster recovery, because there's less pain, less soft tissue damage. It's a faster recovery. People get back to doing what they want. This is a patient of mine, very fascinating. He is a professional horseback rider, got back to horseback riding within a few months of surgery and is still competing. So you can do really whatever you want after a hip or a knee replacement within reason. As long as you tolerate it and as long as it's something you're passionate about, I'm okay with it. Expectations after a total hip. So after 4 to 6 weeks, I would expect you about 80% recovery. And so with that, again, you still might have little aches and pains, some activities. If you're just getting into it again, or you did a little more than you usually do, you're going to be sore. Your body's still healing, your body's still adapting to your new hip. And so you can still expect some little aches and pains after those first 6 weeks. No functional restrictions again after your surgery. And after 6 weeks, again, I gave you no restrictions in terms of your activities. Most people are off the walker within a week, sometimes 2 weeks, sometimes longer. Everyone's different again, but it's a much quicker recovery than a knee replacement. And this is a picture of the hip replacement. So titanium alloy, ceramic ball, plastic liner, and then titanium cup. And so you can see it fits inside the bone. And all of these implants for hip replacements are press fit. So what that means is that we're not cementing them into the bone like we do typically for knee replacements. But there's a porous coating on it. It's like a 3D printed coating that has some material that stimulates bone growth onto that implant and actually grows into that implant. That implant becomes part of the bone. And so that really leads to longevity and reduced risk of these coming loose or wearing out over time. And then one of the new things that has been more popular lately, and I've been doing for the last year or so, has been the bikini incision. So with that right there, that little incision right there, has been a big change. Less healing issues. It's more cosmetic. There's no up and down scar it looks a little more prominent. These bikini incisions fade away. Very few people even notice them, and it kind of sits right there in the crease at the front of the hip. And we call it bikini incision because typically a bikini would hide it. So it's been very good for accelerated healing and quicker recovery. So that's kind of takes the end of my PowerPoint or presentation. This is my team at East West Surgery Center. We're proud of this. A couple years ago, we were the first surgery center in hospital really on the west side of Atlanta to have a robotic-assisted joint replacement program. There's been a couple others that have joined on since then, but we were kind of pioneers on the west side, and so we were really happy to get that started and bring that to our patients.